Good afternoon, everyone, and welcome back to my Friday message. I hope you all had time to disconnect and recharge as I did. I do want to wish everybody a happy new year, but I do realize that you are likely struggling to process, as I am, the horrendous chaos and violence in DC this Wednesday. What keeps me focused and inspired is the fundamental goodness in our core missions and your commitment and passion to those missions. So speaking of the fundamental value and inherent goodness in our core missions, my special guests today are co-founders of Duke's Latin 19 initiative, Viviana Martinez-Bianchi, Associate Professor of Family Medicine and Community Health, and Gabriela Maradiaga, Assistant Professor of Pediatrics. But first, some news. This week has been particularly difficult as we continue to see distressing increases in COVID cases, hospitalizations, and unfortunately deaths across the country and in the state of North Carolina. The 7-day running overall positivity rate in the Duke Health System is 13.7%, and among those presenting with symptoms at Duke, the positivity rate is to 28%. Across the state, the positivity rate is 17%. As of yesterday, Duke Health had 180 patients hospitalized with COVID, which we are watching closely in hopes that this has stabilized. So these are all troubling trends in the pandemic and are likely driven by back-to-back holidays and overall fatigue with safe practices. The contribution of more infectious isolates now identified within the states is difficult to determine until we have more information about how widely these isolates are circulating. This week, Governor Cooper extended the state's current modified stay-at-home order through January 29th. As you know, that order requires that restaurants, bars, entertainment venues, personal care businesses, and other establishments close from 10 p.m. to 5 a.m. I know this information is disconcerting at best. However, I want to remind everybody that we know our safety practices work and will continue to work if we follow them diligently, both within Duke and outside our institution. And for those of you experiencing the stress of what we're experiencing, there are people and resources here to help you navigate this continued stress. I encourage students to contact their advisors and mentors or CAPS if you need support. And there's Duke's Personal Assistance Service or PAS available for faculty and staff. But the bright light at the end of the tunnel is the vaccine. Duke has rapidly scaled up infrastructure to facilitate distribution as we receive vaccine doses from the state. I visited one of our new vaccination sites on Wednesday and was so pleased to see so many of our health professional students providing voluntary staffing. As of yesterday, over 12,000 within Duke Health have been vaccinated, with over 21,000 invited as part of Phase 1A. This has included our frontline healthcare workforce and clinical and laboratory researchers at high risk for COVID exposure. And this week, with the state approval, Duke began moving from 1A to 1B, and the first group in 1B will be those over 75. Individuals receiving care at Duke Health and members of our Durham community over the age of 75 will be able to schedule appointments to receive their COVID vaccination. This phase will occur over several weeks as determined by the availability of vaccine. Many thanks to all of our colleagues in Duke Health that have developed a very organized, high throughput, and safe infrastructure for vaccine administration. However, the manufacture and distribution of vaccine doses will take place over months, and administration must follow guidelines provided by the state. And all of us, even those that have been vaccinated, must continue to follow COVID safety guidelines. We need to be patient. There are useful sites to stay up to date on our vaccination initiative, as well as information on safety and efficacy from Duke Town Halls and national resources, as shown on this slide. Our School of Medicine students started to return this week, and as are our PhD students. They will be participating in both re-entry COVID testing as well as the continuous surveillance testing that got us through last semester. And finally, we will be continuing our monthly COVID lecture series with the next seminar on January 26th with speakers Charlene Wong and Hiro Matsunami. And you can find the Zoom link and more information on the slide shown. So Gabrielle and Viviana, thank you so much for being here today. And more importantly, thanks for your tireless efforts. You've been engaged since the early pandemic and advocating for the Latinx community, which, as we know, COVID has had a disproportionate impact. So Gabriella, starting with you, can you kind of walk us through what that COVID-19 impact has looked like throughout the pandemic on the Latinx community?
Sure. Thanks for the question. You know, COVID has touched all of our lives, both here in this country and around the world. And as you said, uniquely for our Latinx community, the effect has been really devastating. And there are a few reasons that I'd like to go through. First is the lay of the land, reminding everybody that right now there are about 1 million North Carolinians who identify as Hispanic or Latinx. We are about 10% of the population. And that's been steadily growing over the last 30 years. Back in 1990, it was 75,000.
Wow.
So really big increase. And right now here in Durham, it's about 14%, a little bit higher. So when you have that as background, and then you look at the numbers for COVID infections, right now the average across the state is about 24%. So if we're thinking that 10% of the population is Latinx, but we make up 24% of the cases, that's really remarkable. And then even worse was this summer here in Durham, those data are really devastating. 75% of the cases in June in Durham were Latinx. 3 out of every 4 positive cases were Latinx. So really a remarkable heavy burden.
Yeah.
And for those of you watching who work in the critical care units or on the pediatric floors, this is not a surprise because almost everybody admitted at that time self-identified as Latinx. And in the pediatric population, almost every single case admitted was Hispanic. And of the very few pediatric deaths we've had in the country, about 20, one of them was a young girl from Durham, a Hispanic young girl. So really the devastation and the weight of this pandemic in our community has just been enormous. And you start to think of why, right? What are the factors that predispose or don't mitigate in our community? And there are several. So you have to think of exposure. You know, where do people work? Our community does a lot of frontline essential jobs, construction, food services, meat processing plants, agriculture, environmental services, cleaning, people who cannot work from home. As Viviana has said very well, you know, when everybody was able to shut down and work from home, our community kept the economy going and had to show up to work, often in environments that were not very friendly or safe. And so the higher rates of exposure were really huge. In addition to that, once you have the exposure, what happens? All of us as scientists and doctors, we love data and information. For this community, there was a huge lag in information in a language they could understand. So when you don't have the information, it's really hard to take precautions. What about after you have the information? How do you take care of yourself? Well, you may say you need a test. So if you look at Durham and you look at the testing sites through July, you could draw a dividing line. And all the tests were on the west side of town, where the majority of Hispanic and Black residents are on the east side of town. So access to testing was really hard. Additionally, quarantining for a lot of people who earn a daily wage, really an impossible choice, people who could not stay home. And then finally, access to care. For a lot of our community, there are many fears related to financial ruin, fears related to immigration and treatment, and then a sense of not being welcome necessarily, concerns about language and communication. So all of these really, you know, got together in a perfect storm to create such devastation in this community.
Well, so fortunately, you and your colleagues anticipated some of that perfect storm and organized a very effective group of advocates, Latin 19, and you've been meeting tirelessly and intervening at every step of the pandemic. So Viviana, can you talk a little bit about the success? And I'm sure that you will say it's because of a lot of people's efforts, but the effectiveness has been extraordinary. And I also want to note that the state has recognized your group as a very important part of an effective intervention. So tell us about it.
Yes, thank you. So Latin 19 stands for Latinx Advocacy Team and the Interdisciplinary Network for COVID-19, a name that was coined by our colleague Gabriela Nagy. It's a voluntary organization of leaders, advocates and allies of the Latinx community in North Carolina. And we started meeting back at the very beginning of the pandemic. March 18th was our first meeting. When we started recognizing, Gabriela Maradiaga sent me a message. Alex Villeda, one of our medical students, was involved with this, thinking about what was going on, how will this affect the community. And what has been, I think, the most telling thing is the commitment of multiple individuals. Like you said, I was going to give credit to others because it's this collective work, the work of multiple people that have come back together every Wednesday at noon to discuss the issues, to pay attention to what is going on with the community, to listen to the community. As a doctora Latina, myself, Leonor Corsino, Gabriela Maradiaga, Gabriela Nagy, and so many other colleagues that are Latinos have heard the stories from our Latino community directly for years, since we started taking care of them, or as Latinas ourselves. But there's never been this place where everybody comes together. We have 70 to 100 people that come together every Wednesday to talk about and to hear the community themselves. When they are sharing their expertise, this group recognizes that the experts in how, especially COVID, is being felt, what is the impact on the education of children, the experts are the community members themselves. So I think the biggest success of Latin America has been that of convening this collective group of people from all these different backgrounds, learning from the community, and then creating advocacy paths and creating committees and groups. For example, advocacy for the needs of the Latinx community, working directly with the government, paying attention to, at the very beginning, there was no information in Spanish. So getting that information in Spanish, working with the county health department, working with the Department of Health and Human Services, paying attention. We sent letters when we didn't see the information happening, and the letters were responded with invitations to dialogue. And I think that invitation to dialogue was what opened doors. And then we have never stayed with just the conversation. We see a problem, we get a team, and we have so many very committed individuals and stakeholders from multiple different institutions who get together, who come together to make a difference. We have had lawyers talking about issues of immigrations and human rights. We have had members of the School of Nursing talking about the work that they're doing directly as public health nurses, directly with research. We have had members of different schools at Duke University, not just the School of Medicine and the School of Nursing, but the School of Law. We have the Margolis Center. We are really convening. I don't know that, having been for 15 years almost here at Duke, I don't know that I've ever seen a group that so closely formed bonds. I was thinking about, yesterday's difficult time and thinking about love and where to find love. And I find it in this group of people that gets together every Wednesday, where I think this is the safe space to share, to advocate, to make decisions, advocating for policy changes, for procedure changes, noticing things. The truth will get us where we need to go. There were no signs in Spanish anywhere in the hospital. And Dr. Shannon came into the meetings, listened to us, paid attention, and went around and started changing that, right? Like, we're seeing this commitment to making a difference. I want to say that another success of the Latin 19 group has been that we know that the community has always have a voice. Communities always have a voice. The issue is who's listening. And suddenly we have a very broad, large community of people who are listening to what the community is talking about, who is really paying attention and putting their heart out to make a difference.
Not only is the community listening, leadership is listening.
And that's my point, right?
At the state level, at the institution level, they are looking to you and your colleagues and listening. And I think that's just a credit to the effectiveness of your group. But we are approaching a very challenging inflection point in the pandemic. So in the midst of a soaring surge, there's the light at the end of a long tunnel with the vaccine. But so many challenges ranging from vaccine access, which I'm sure you worry about, as do I, to really significant concerns about safety. So Viviana, what are you thinking about in terms of how do we approach these challenges with vaccination, particularly in Latinx communities?
So for the Comunidad Latina, the information needs to come from trusted sources. I held a meeting with 27 Spanish-speaking community health workers who are part of that category 1A, who are exposed day in and day out to people with COVID-19, and they should be part of this group that needs to get the vaccine first. And one of them said something that was very telling. She said, my concerns and those of my community have been ignored or dismissed all my life. And now you want to vaccinate me in the first group? Why am I so important now? And it really got me to have first it was this heavy heart, this recognition of a community that hasn't felt recognized for so long. But then it was this like recognition of we are in a different moment. We are working together with the Department of Health and Human Services that is recognizing the contributions of this very important group of people. We are working at Duke University recognizing the contributions of Latinos in our own floors, in our own teams, and we are making sure that we have vaccine equity, that the vaccination really reaches all of the members of the community. And so it was so important for me to be there during that meeting, sharing that, is that yes, that we now have leaders who are recognizing the importance of your contributions to our community. Some other questions were how to make sure that they're getting the real vaccine and not a vaccine for Hispanics, not a vaccine that will give them something or put a chip on their deltoid muscle that will be tracked by the government if they were not here with documentation. How to make sure this is not like a plot that occurred in Atlanta where people went from a detention center to the hospital and they got sterilized. How do they know that this is a vaccine that is not going to cause them a problem, right? For the Comunidad Latina, experimentation on their lives or dismissal of their or disregard of what happened to them, it's a real thing. And it's not.
Oh, yeah, I certainly understand it is a real thing. My concern is as there's a shortage of vaccines, and that's going to be true for several months, that we will miss an opportunity to engage the Latinx community in developing a trust of the vaccine. So how are we doing that?
So one of the things that we're doing, we have already held 2 sessions during Latin 19 with Dr. Wolf. All of our Latin 19 talks, conferences or meetings at noon are translated into Spanish and from Spanish to English. So in fact, Cam Wolf was fantastic. He ended up staying an extra hour, came back the following. So it was December 30th. And again, this last Wednesday, we did it again. And then we have been working, I personally have been working with the Department of Health and Human Services, developing conversations with different community members, and we are actually training members of the Latino community to be trainers themselves, to talk and share why the vaccine is important. I think we need to create a very safe space for people to get vaccinated. And when we talk about safe, we talk about a place that has information in Spanish. Our own website needs to be in Spanish. This is where you register. We need to, and this is for all of our community, not to be sending out a confusing message. You know, I need to be vaccinated. I am category whichever, 1A, 1B, 1C, or 2 or 3, whichever group I belong to. So where is it that I register, and how easy or not easy it is to register? Broadband access is an issue for some members of our community, which also Gabriela could talk about how difficult it is for children to log on to do schooling, for example, right? Yeah. So we need to continue to do this approach that is looking at this and health, not just from the healthcare portion, but the socioeconomic implications. We need a massive information campaign in Spanish so that people are going to be, you saw Gabriela and I getting vaccinated early on, going on. Yep. on many media outlets just to share how important we know this is and how thankful we are to a vaccine and that we consider that it is safe. It's confiable, the word in Spanish.
Both of your advocacy predates COVID, and COVID has given us an opportunity to build stronger connections. So what are your kind of hopes and dreams coming out of COVID in terms of that engagement with community? Gabriela?
We always try to find silver linings in pediatrics, finding that bright spot in our children, and thinking of all the devastation and sadness and pain and suffering from COVID. I agree with Viviana that raising the voices of people who have not felt heard for so long has been very powerful and a very important message that we can't go back to the way things were. Maintaining that true commitment to investing in this community. And one thing I always say when I share these talks is there is no them. There is just us. There is no them. There is just us. And we need to go into everything that we do like this with that mindset. And our hope in Lat19 is that we can grow on this model of collective action and community engagement to build a center for excellence here at Duke that continues this important work, reaching out in all these important aspects: research, community involvement, education, and all the modalities that people need for health and wellness so that we can continue the important work for many years to come.
If I may, we dreamed this, like Gabi said, this Center for Excellence in Latino Health, right? In health being seen from a very broad perspective, that includes so many different schools and centers at Duke per se. Just like we put together this Lat19, where we're learning from each other and we're learning from the community, and every contribution is valid. We think that this is a model that is now taking national attention. We just did presentations to the Human Resource Service Administration. We have done presentation to the Resilient American Community Network. Suddenly it's like, what are you doing? We want to see. We have now people joining us from Florida, from Oregon, from Colorado into our weekly meetings, looking at what we are doing. So we have a really important opportunity.
Well, your vision is exactly where it needs to be, and you need to hold us accountable to partner with you so that we don't lose the trust and partnerships that you've worked so hard to develop. So thanks to both of you. Hopefully the next couple of weeks we'll be able to partner more as we really start seeing the vaccine roll out into the community. And thanks to all of my Duke colleagues. I hope you all have a restful and peaceful weekend.